Hi, thanks for sharing your discussion posts. I found them really informative, and I really liked how you described particularly the WhatsApp app, because at first when you described it, I thought it was really good. It was probably very beneficial, but as you went on and you kind of talked about the cons, you talked about how there wasn't that much professional help within it, so that kind of painted a clearer picture for me, and it did kind of remind me of like how the textbook talks a lot about how people may use these health apps to diagnose themselves, but these health apps kind of lack the steps for recovery, because when I first heard about that app, I thought it was a very good alternative to if you can't afford certain medications for your mental health or actually going to therapy. And while I do still think from what you've described and how you described it as like a general resource, how it's a good maybe stepping stone, it does seem like it's not comprehensive enough to actually be useful or beneficial on like a long term, but I do see how like these apps, it made me realize like how these apps could be very good in the process of getting health care, but they're not good for like a long term sort of and like being reliant on them to answer all of your healthcare needs, which is also kind of what the textbook says about how like a lot of this online and healthcare is in the right direction, but overall the use of like actual medical professionals is still necessary. So thank you.